to Your Health, where we explore the latest in health across the country. I'm Erica Cardenas. Today we're here at the University of Arizona College of Medicine in Phoenix to talk about health literacy. But before we get started, let's take a look at what's coming up on the show. Tips on becoming a better health advocate for yourself. And we'll show you some delicious dishes during Global Vegan Month. Plus, helping the community get the health services they need. All that and more on today's show. According to recent studies, more than 40% of Americans have trouble obtaining and understanding basic health information. Here to tell us more is Dr. Shad Marvasti. Welcome, doctor.
Thank you.
So first off, this is Health Literacy Month, so why is it so important for us to understand basic healthcare information?
Well, it's critical. Health literacy is the ability for individuals to not only find information about health, but be able to understand it and then use it to take actions proactively for their health.
So is the problem access to the information or just understanding it, or maybe it's a mixture of both?
I think it's a mixture of both, although the internet has definitely exploded in terms of all the different stuff that's out there, but there's also a lot of noise, right? And then there's also misinformation. So I think that's where it gets a little bit confusing. And in medical school here at the University of Arizona College of Medicine Phoenix, we make it a point to train our medical students not to use jargon, right? So that's one part of it on the medical side, right? We don't want to just throw out terms, throw out statistics without trying to explain it in ways that patients can understand, and then really engage them in that decision-making process. We want to be able to empower you with the information that you need.
So speaking of empowerment, what can we do as patients to increase our health literacy?
Yeah, one of the most important things is when you're at the doctor's office, you want to ask questions. If you don't understand anything, don't be shy about saying, look, I don't know what you mean by that. The other thing that I always encourage patients to do is to bring a loved one with them. Because two heads are better than one, right? Having more than one person there, being able to take notes, right? And be able to compare those notes and then actually, repeating back to the doctor saying, hey, did I understand this correctly? So what you're saying is this. So all those kind of strategies I think are really useful. And then, being able to, do a little bit of homework before you come in. You can read about it, but then ask for health education information. Most clinics and offices will have, accessible, easy to understand information, patient education handouts. So you want to ask for those and make sure that you understand them, and hopefully they're available in the language that you speak as well.
So doctor, how does misinformation play into all of this?
Unfortunately, we saw this play out in great detail in the pandemic. People have there's different health trends that are always, on any social media platform. So really, I think looking at the source of that information, coming back to your doctor's office, being able to have access to really good primary care is really important so that you can have that dialogue and be able to kind of vet whatever information you get.
So we do, of course, have access, at our fingertips to loads of information. Is there such thing as having too much information to where, we become overloaded?
I think so, and I think that's where your primary care physician comes in. Really, you have to look at them as their quarterback, and I think that will improve health literacy and outcomes overall, is if we can get more access to everyone to have a primary care doctor to be able to make sense of that information. And if you don't have that, then that's really problematic.
So Dr. Shad, any final tips, advice on how we can be better health advocates for ourselves?
Well, I think the key is to ask questions, okay? Know that you have a right to ask questions and to also ask for clarifications. Bring a buddy, bring a family member to any patient visit that you have with the doctor. And when in doubt about something you see, find a primary care doctor, establish a relationship with them, and ask those questions there so that you can have a good understanding from someone who knows what they're talking about and not just trust whatever trend you see online. And if the organizations that are out there in healthcare also does everything they can to provide understandable, accessible health education for patients, we're all going to get towards this goal of health literacy. We're going to work towards it together.
Dr. Shad, thank you so much. This is such great information. If you'd like more tools on how to increase your health literacy, just head over to the website. We all know the consequences of driving impaired, and the Portsmouth Prevention Coalition is hoping to bring the reality of this to the community with its simulated experience.
I'm Joan Warren, the director of the Portsmouth Prevention Coalition. Today we are here with the Portsmouth Police Department training on the use of the Sydney golf cart. Sydney stands for Simulated Impaired Driving Experience. Together with the Portsmouth Prevention Coalition and the Newport County Prevention Coalition, we were able to fund the Sydney golf cart. Drunk driving affects our community in so many negative ways. Portsmouth in particular has seen quite a bit of DUIs. So the whole community is at risk. So we take this very seriously. Portsmouth police are wonderful when it comes to monitoring our streets.
Hi, I'm Lieutenant Richard Ruist. I'm with the Portsmouth Police Department, and we're out here today to train on the Sydney. We have our team out here of 5 other officers and myself, Joan from the Prevention Coalition, and we're training on how the machine works and how it can simulate impaired driving, especially for our youth, and that's going to be our target audience. Definitely gives them a hands-on experience, and there's an educational component to it. It's not just that you're driving a go-kart. It's going to be part of an educational program where you're talking about drunk and impaired driving and better choices. That's really what it is about better choices before they get behind the wheel and before something happens. Hopefully this experience will give them the deterrent not to do it. When you switch it into impaired driving, it gives you a delayed response, which you're going to have naturally. You're going to have delayed braking. So it simulates that type of action if you were impaired driving a motor vehicle.
In the winter months, we'll probably have it indoors at some events.
Obviously, it's better outside because you definitely have more space, but inside, as long as we have safe parameters.
You know, we want to take it out before proms and graduation and make sure that it's utilized in the best possible manner. We have worked very closely with the Portsmouth Police Department. They have been very supportive.
It's just the overall support and knowing that if we need something, and as long as we ask, they'll try to accommodate, and I think they feel the same way.
I'm going to actually maybe drive it if you want to get a little bit of that. I won't swear. Not easy. So I think this is a great tool. It's going to really help the young people realize the dangers of impaired driving and drunk driving. We want to make sure that young people in our community make good decisions and stay away from drugs, alcohol, and tobacco, and make this a lifelong decision. I thought I was doing so well.
One way to help with health literacy is to bring a friend or family member to your next doctor appointment. They can take notes for you just in case you miss something, and they might even ask a question you may not have thought of. Stick around, there's more coming up. A vegan influencer talks to us about a plant-based lifestyle and healthcare that's making an impact in the community. Veins can be unsightly and cause uncomfortable symptoms, but there is a way to get rid of them. The team at San Diego Varicose Vein Treatment Center show us how.
San Diego Varicose Vein Treatment Center, we take care of all various needs of patients for management of their venous insufficiency. People who come here are mainly concerned about symptoms that brings them on or issues related to cosmetic concern that we can always take care of. I'm a cardiologist. I'm an interventional cardiologist. I have significant training in heart and vascular and helping my patients in those fronts. Venous insufficiency is specifically pathology in the vein walls, mainly the leg veins, where they become dilated, the size gets sort of plumbed, and blood basically rushes back into the legs where it doesn't need to be. Venous insufficiency shows itself in several different ways, specifically achiness, pain, pressure, tingling, burning, heaviness that happens mainly in the calf and in the ankle region. sometimes spasm, sometimes restlessness.
I was just not feeling very well, and heavy legs. I noticed how my legs looked, and I haven't worn shorts in years. A lot of throbbing in my legs, a lot of swelling, inflammation, and I stopped power walking, and I just didn't feel good. The quality of life that I wanted, that I expect, I wasn't having.
In years past, we used to do vein stripping, but now with the advancement of technology and so many catheter-based treatments, we can treat our patients much more quickly, much more comfortably, with less downtime. The varicose veins are depicted here, and we have the ability to effectively removing them. It's a great cosmetic result. Patients love the result invariably. We have a great satisfaction by really comfortably getting this out and having the best results possible for our patients.
It's been a huge impact in my life to feel better, to be able to power walk again, to not have the swelling, the itchiness, the redness, the complications, and sleeping much better. And overall, I'm just feeling like I used to feel when I was a lot younger, and I'm so grateful for this place.
It's a privilege to take care of our patients. If somebody has some issue that bothers them and I can help them, I mean, can you imagine something better than that?
Great.
That's our plan. It's just, it comes from the heart, and I love it.
Joining me now is Paco Franco, Medicare Benefits Consultant with Clever Care. Thank you so much for joining us, Paco.
Thank you so much, Erica. I really appreciate it.
First off, we hear that Clever Care is a health plan customized for growing diverse populations. Can you tell us more about that?
Yeah, absolutely. One of the most distinct differences of Clever Care is that we combine the principles of Eastern and Western medicine to our approach of healthcare. We believe in the complete well-being of our members and believe that wellness should be affordable. Clever Care offers member support for services in various different languages, whether it be Tagalog, Chinese, Korean. But in addition, you can also visit our various community centers that we have in Koreatown, Westminster, San Gabriel Valley, and there you'll be able to have personalized service from our knowledgeable team members.
So, Paco, how does Clever Care differ from other health insurance plans?
Unlike most Medicare Advantage insurance plans, Clever Care is built for your health and culture. Our plan includes benefits that cover Eastern and Western principles, so you're not having to pay more to keep your traditions alive. Plus, we have over 15,000 provider facilities in our network. We've also have over 55 hospitals here in Southern California that specifically speak your language.
Wow, that's great. So what other Eastern medicine benefits does Clever Care offer?
With Clever Care Medicare Advantage HMO plans, we're able to offer benefits that cover Eastern medicine treatments like unlimited acupuncture with no referrals needed, or even services like gua sha, tui na, reflexology, cupping, infrared therapy, massage therapy, so much more.
Now, Paco, there are other Medicare Advantage plans that, offer those benefits too. So what else makes Clever Care stand apart?
Great question. Thank you so much, Erica. Most Medicare Advantage plans are designed with a general person in mind, a number. And your individual wellness and traditions are typically not part of the equation. But Clever Care is built for your health and your culture.
Wow, Paco, that's amazing. So many benefits for sure. So tell us, who can sign up for a Clever Care health plan?
Absolutely. Anybody who's eligible for Medicare can join Clever Care Medicare Advantage HMO plan. We also have another enrollment period coming up called the annual enrollment period. This is the most popular one, which takes place from October 15th to December 7th. And during this time, you can sign up for a new plan, you can switch plans, you can leave a plan, or simply just return to your original Medicare.
Great. Paco, thank you so much for being with us and sharing all of this great information. If you'd like to learn more about Clever Care, just head over to their website. If you're battling an illness, you can ask your healthcare provider if they have patient navigators. This is someone who's trained to navigate the healthcare system and help coordinate your care. Many times, a patient navigator can spend more time with you than your doctor can. Don't go anywhere, we'll be right back. We feature Valle del Sol and all they do for the community and the benefits of living a vegan lifestyle. Valle del Sol has been providing health services since 1970, and it's their mission to help the community with healthcare.
Valle del Sol started over 50 years ago, 1970. The goal was to establish social services, behavioral health services primarily, substance abuse services. The main goal at that point was to serve the veteran community that was returning from the Vietnam War. At that point, there was a lack of services for the Latino community, so that was the main goal, to have a place for the community to come and be served in their language and, with people that spoke Spanish. Throughout the years, there's been a need for additional services, so we started offering primary care, and the whole point of that was to integrate not only the physical health, but also the mental health, behavioral health, social aspects. But the goal, again, is for us to be able to not just only address the one thing, right? We want to be able to be here for the community and in terms of everything. It's better to really find connections, and that way the person feels supported and they don't feel like they're alone when it comes to their health.
Valle del Sol is open to anybody in the community. We do serve a majority of Hispanic and Latinos. The ailments or the chronic diseases that we see a lot, specifically in our Hispanic community, are things like high blood pressure, hypertension, diabetes, high cholesterol, depression, anxiety. These are all things that we as Latinos suffer from and are the things that we mostly come and see the doctor for. Here at Valle del Sol, we also offer not just primary care services for adults, but we also offer pediatric health. Dr. Wooten, our pediatrician, can see them for their well visit if they were behind on their developmental milestones. Then Dr. Wooten can address that. He can set them up with a catch-up schedule for their immunizations. They can get their flu shot, they can get their COVID shot, all in the same visit.
When it comes to Valle, the awesome part and something that I love about Valle is that when you come here, we don't only talk about the one need, right? We love to have the family identify. So, ¿quiénes son las personas importantes para ti? And the reason why we ask that is because when it comes to health, professionals can tell you what to do. But if you get the buy-in from the family and the family understands, then la abuelita, el tío, everybody will help address those needs. Los invito a que sean pacientes de Valle del Sol. We have different locations. We're across the valley. We don't say no to anybody. We don't turn people away. If we don't provide services, we will help you connect. But for the most part, we're a really good place to come and get all of the services that you need. So come to Valle.
We have more Your Health coming up from the U of A College of Medicine. We talked to a vegan influencer about World Vegan Month. November is World Vegan Month, so we wanted to get the latest information from vegan influencer Diana Edelman on plant-based eating.
My name is Diana Edelman, and I am the founder and CEO of Vegans Baby. Vegans Baby is a multifaceted project that I started in 2016 that's designed to help make vegan food and vegan life more accessible and approachable and show people that they're not missing anything by going vegan. I have a travel blogging background and a PR background, so I decided I would start a site that basically would follow me as I went and ate food around the city and showed people what was vegan and where we could find vegan food. Since then, it has grown to be not only a site, but I now curate tours around the world. I have a vegan dining month. I've expanded to multiple cities. And every year I put out the Las Vegas Vegan Dining Guide, which covers about 45 different categories of the best vegan food in Las Vegas. Being vegan means you are doing your best to cause no harm to other living things. So it is everything from not consuming animal products and animal byproducts to what you wear, to the products you use in your daily life, hair, shampoo, makeup, nail polish. It's a lifestyle that doesn't involve animals and animal byproducts. So there's three main reasons people go vegan. They go vegan for the animals, they go vegan for the environment, and they go vegan for health. There's been a lot of studies that have come out showing that if you go on a whole food, plant-based diet, that it can reverse heart disease and diabetes and things like that. But that's actually more that people are going plant-based because they're not necessarily going to make the whole vegan lifestyle change where they're not consuming any byproducts or anything like that. Vegan food is more than a baked potato, it's more than a salad, it's more than a plate of fruit, that there are restaurants out there that are just doing incredible things and showcasing the versatility of the cuisine and doing a really good job. We are here at Taco Terrier in Las Vegas, Nevada. They actually have 4 locations here in Las Vegas and they just opened one in San Diego. They are a plant-based Mexican eatery. They have the largest selection of tacos in the world, and they also have the world's biggest taco, which, no joke, is like the length of my forearm. There's an amazing spot in Las Vegas called Garden Grill that actually does a fried chicken bucket that's vegan, and it's phenomenal. There's a burger shop here called Underground Burgers, and those burgers are insane. You would never know that they're vegan. I created Vegan Dining Month 6 years ago, basically as an answer to Restaurant Week. I remember I was driving in Las Vegas and I saw a big billboard for Restaurant Week, and I looked up to see what restaurants had vegan options, and none of them did. And so it started in Las Vegas, and then we expanded to Portland and San Diego, and now this year it's Portland, Las Vegas, and New York City. Restaurants around the city have a vegan dish or a few vegan options, and then we pick a local charity, and so at the end of the month, a portion of the proceeds from those dishes sold will go to that local charity. Typically, it's an animal sanctuary. What I love the most about being vegan is that I wake up every morning knowing that I'm doing the least amount of harm and that I'm contributing to make the world a better place. It's so good.
We want to thank everyone here at the U of A College of Medicine in Phoenix for hosting us today, and thank you for joining us in your health. We hope you have a happy and healthy day. I'm Erica Cardenas. See you next time.